Namaste. Thank you for joining us here on SLG Hello Doctor's 29th episode. Today, we will be discussing the matter of colon cancer with Dr. Goutham Kumar, Consultant Medical Oncologist at SLG Hospitals, Hyderabad. Colon cancer is a type of cancer that begins in the final section of the digestive tract, which is the large intestine or colon. It is the third most commonly occurring cancer in men and the second most occurring cancer in women. 60% of the cases are encountered in developed countries, and the mortality rate stands at 8% of all cancer deaths. In India, the incidence figures stand at 4.4 per 1 lakh men and 3.9 per 1 lakh women. Welcome, Dr. Goutham, to SLG Hello Doctor.
Hello, I'm glad to be here.
Thank you for joining us on this platform that brings health information to our viewers every fortnight.
Sure, I'll be able to answer more of all the questions.
So, Doctor, shall we start our conversation?
Sure, definitely.
To begin with, what is colon cancer and where does it occur?
Digestive tract, as we know, it starts from esophagus, it goes into stomach, and from stomach, small intestine starts. After small intestine, large intestine starts. So, colon cancer is a cancer of large intestine, and it is divided into three parts: ascending colon, transverse colon, and descending colon. Any cancer occurring in these three parts is called as a colon cancer.
What are the risk factors that are associated with colon cancer?
Colon cancer, it usually occurs in older age. Age more than 60 years is one of the risk factor, and it occurs more frequently in males than females. And consumption of high carb diet, low fiber diet, consumption of more red meat, smoking, alcohol, obesity, and there are some autoimmune conditions like Crohn's disease, ulcerative colitis, and some genetic conditions like what we call as Lynch syndrome or FAP. These can increase the risk of colon cancer.
What are the symptoms of colon cancer that one should be alert to?
The most common symptoms that patient come to us with is blood in stools. 60 to 70% of the patient come with these symptoms. This is the most common symptom, and the other symptoms include any chronic constipation for more than 3 to 6 months, or chronic diarrhea that is occurring for more than 3 to 6 months, or abdominal bloating sensation, weight loss, or any dyspepsia symptoms. These are the common symptoms patients come to us for colon cancer.
Doctor, are there any specific tests that will detect colon cancer?
Yes, there are specific tests. First, if you suspect a colon cancer, we'll do a colonoscopy. Colonoscopy identify if there is any mass in the colon, and if needed, if there is a mass, we get a biopsy from the colonoscopy, and other investigations we do are CT scan or PET CT scan to know the exact staging of the colon cancer.
Doctor, you spoke about staging just now. So what are the stages of colon cancer?
Colon cancer is also divided into 4 stages. Stage 1 is the cancer that is confined to only epithelium is called as stage 1. Once it crosses the basement membrane and enters into the muscle layer, we call it as stage 2. If the adjacent lymph nodes are involved, we call it as stage 3. And if it spreads to other organs like liver, lung, or brain, we call it as stage 4.
Are there many treatment options available for colon cancer? Can you enumerate some of them for us?
Sure. Medical oncology wise, there are many new treatment options are available for colon cancer. First, we start with basic chemotherapy. We have 2-3 options for basic chemotherapy. For that, we can add newer antibody drugs like bevacizumab, or we look for specific mutation testing like KRAS, NRAS. And if these mutation testings are negative, we can add new drugs like cetuximab, panitumumab, or we test for newer mutations like MSI or PDL1, and if they are positive, we can give immunotherapy drugs. And in second line and third line, we have also got new oral medications for colon cancer.
It's break time on SLG Hello Doctor.
ప్రపంచ స్థాయి మల్టీ సూపర్ స్పెషాలిటీ హాస్పిటల్ SLG Hospitals.
4 ఎకరాల సువిశాల ప్రాంగణంలో 999 బెడ్ల సౌకర్యంతో గ్లోబల్ JCI అండ్ NABH ప్రమాణాలతో అనుభవజ్ఞులైన వైద్య నిపుణులతో అత్యంత క్లిష్టమైన గుండె సమస్యలకు శస్త్రచికిత్సలు చేయబడును.
మెదడు మరియు నరాల సంబంధిత సమస్యలకు మొట్టమొదటిగా న్యూరో నావిగేషన్ టెక్నాలజీతో చికిత్స.
క్యాన్సర్ చికిత్స కోసం లీనాక్ వంటి అత్యాధునిక వైద్య పరికరాలతో చికిత్స.
కీళ్ల నొప్పులు, ఎముకలకు సంబంధించిన సమస్యలకు మరియు జీర్ణకోశ సంబంధిత వ్యాధులకు మెరుగైన వైద్యం అందించబడును.
20 అత్యాధునిక ఆపరేషన్ థియేటర్లు, 200 ఐసీయూ బెడ్స్, అత్యాధునిక డయాలసిస్ సదుపాయం కలదు.
24 గంటలు ఎమర్జెన్సీ, డయాగ్నోస్టిక్, ఫార్మసీ సేవలు.
3 టెస్ట్ల ఎంఆర్ఐ, సిటీ స్కాన్ వంటి అత్యాధునిక వైద్య పరికరాలతో మరింత మెరుగైన సంరక్షణకు మీ ఎంపిక ఎస్ఎల్జీ హాస్పిటల్స్, నిజాంపేట్ రోడ్, బాచుపల్లి, హైదరాబాద్.
సెల్ నంబర్స్ 9133395500.
ఫోన్ నంబర్స్ 914023785678 మరియు 48525678.
టోల్ ఫ్రీ నంబర్ 1800599220.
ఎమర్జెన్సీ 7799235678.
ఆంధ్ర ఆరోగ్యశ్రీ సదుపాయం కూడా కలదు.
Welcome back to SLG Hello Doctor. We are in conversation with Dr. Goutham Kumar, Consultant Medical Oncologist at SLG Hospitals, Hyderabad, and we are talking to him about colon cancer. Doctor, with such rapid advancements in medical technology and treatment modalities, is there any new way of treating colon cancer more effectively but less invasively?
Treatment wise, we can divide it into 3 ways. One is surgical, radiation and chemotherapy. Surgical, we have got new procedures like robotic surgeries, laparoscopic surgeries, which are minimally invasive, and it can drastically reduce the loss of blood or hospitalized stay and pain for the patients. And radiation wise, we have got new machines that can treat the cancer precisely with 1 mm margin. And chemotherapy wise, we have got new medications like immunotherapies, oral targeted therapies to treat colon cancer.
So, doctor, we just spoke about the treatment modalities, the treatment options that are available. What is the methodology of treatment when they come to you at different stages?
The treatment is based on the stage of the cancer. Usually stage 1 and stage 2, we call it as hemicolectomy, where the surgery is done to remove the tumor, and followed by the surgery. If it is stage 1 and early stage 2, there is no need for chemotherapy also. For that, we do a genetic test called MSI. If the test comes as positive or high, we avoid chemotherapy in those cases. Or if the test is negative or it comes as MSI is low, we generally give chemotherapy. We can give a single agent chemotherapy also for that. If it is stage 3, we generally give chemotherapy and look for the response after few cycles. If it is operable, we operate. If it is not operable, we will continue the chemotherapy and look for response after the end of chemotherapy and try to operate. If it is stage 4, there is no role for any surgery. We generally treat with chemotherapy, and it is done to prolong the life.
Doctor, since this is a disease of the digestive tract, what lifestyle modifications, be it an exercise regimen or be it our diet, should we follow to prevent us developing colon cancer?
Consumption of more dietary fiber diet, exercising for 35 to 45 minutes per day, avoiding alcohol, smoking, and sedentary lifestyle will drastically reduce the risk of colon cancer.
Doctor, as in the case of many other cancers, I'm assuming even colon cancer would have a genetic trait to it. So in case I am genetically prone to colon cancer, what are the precautionary measures that I should take to not develop it further as I age?
If there is a family history of colon cancer, there is a risk to genetically get the colon cancer for the children also. If there is a family history, you should go to a medical oncologist or a genetist to get tested for a specific gene mutation testing if there is a positive family history. And if the mutation turns out to be positive, then you should get a colonoscopy done to look for any cancer in the colon tract, or if there are any precancerous lesions in the colon tract. And you have to follow the guidelines suggested by the medical oncologist or a genetist with frequent follow-up with a colonoscopy or blood markers very frequently, like every 1 to 2 years. And you should look for any symptoms for colon cancer, get alerted as soon as possible, and meet a medical oncologist if there are any symptoms.
Highly obliged, Dr. Goutham, to have you here on SLG Hello Doctor and talk to us so much in detail about colon cancer and how to deal with it.
Thank you. It's my pleasure to be here. Thank you. Thank you.
We'll see you back here in 2 weeks from now. Until then, be healthy and enjoy responsibly. Viewers, hope you've hit the bell icon and are following all that's happening on SLG Hello Doctor. If not, do it right away.